Hello, Mrs. Janet Smith. My name is Dr. Charlie Shuttleworth.
Hi.
I believe that you've had some bereavement and your GP had some concerns. I thought it'd be helpful for me to talk to you. Is it possible to tell me a little bit more about what's happened, please?
Yeah, I lost my husband, unfortunately, unexpectedly, a few months ago. And my daughters were a little bit worried, just because I've had some odd experiences following this, yeah.
First of all, can I just express my condolences for your loss? I understand you were married for 30 years.
Yes, and it was a real shock when it happened, because my husband Ken had been really well, fit and well, and it was unbelievable, really.
It must have been really shocking for you. I can't imagine how you're feeling.
Yeah.
Is it okay if you feel able to just tell me a little bit more about the circumstances of how he died and whether it was sudden and things like that?
Yes, it was pretty sudden. He had some chest pains the night before, but we assumed that was heartburn because he suffered from heartburn here and there. And he just went up the stairs to get some very normal, just get some antacids or whatever, and collapsed on the stairs. So I called an ambulance, and he went to the hospital, was admitted to a cardiac ward. I couldn't get to see him because it was all quite frantic. But the doctors did say there was no point in me staying that night and that I should go home because there was nothing more to do that night. And then in the early hours of the morning, they called and said he passed away, and so it was something to do with some cardiac rhythm. And I just could not believe. I still can't believe it. I still can't believe it.
Sounds like it was a terrible shock, and yeah, as you say, trying to come to terms with what's happened. Oftentimes, when people do have a major shock or bereavement like that, they can have various emotional reactions to what's happened. Are you able to tell me a little bit? You started to explain some of the shock that you were feeling. Are you able to talk about any of the other feelings that you've had associated with the
Well, obviously I miss him, but I think, I don't know, my daughters are saying that some of the stuff that's been going on isn't normal, but I mean, yes, there are moments, where I could swear that, he's still there. But I don't find that frightening. I find that I quite like that. I don't really want that to go away.
And we're going to come on to it, but quite often when people do have a major shock, a bereavement like that with a loved one, they can have a range of emotional states that they go through. I just want to ask some screening questions about low mood, if that's okay.
Yeah.
Are you able to get any enjoyment from life at the moment?
I mean, here and there, I can still smile with my girls, and I can still, the odd, yes, there are times where I'm feeling okay, which I feel guilty about. But then there are other days that are just very, very difficult.
Absolutely. So it sounds from what you've said as though, understandably, there are very difficult days and you feel very low and you miss him and you have these unusual experiences, which we're going to talk a bit more about. But generally, you're still able to get some enjoyment from certain activities.
I mean, I've got my children, I've got my grandson, things like that.
And things like your appetite and your sleep.
Improving a little bit, but yeah.
Do you still have energy to do things?
Yes, but there are days where I don't, and there are days that I think there are good days and there are bad days.
Absolutely. And can I just check whether you still have some hope for the future, that you think that you can get through this?
Yeah, I do. I mean, I don't really. It's hard to imagine a future without him, still. But yes, of course, I have to be there for my children.
And I just wanted to check, sometimes when people are going through something really stressful and a bereavement like this and a big devastating loss, they can have thoughts that life's not worth living or have suicidal thoughts. You're not having any thoughts like that? Okay. Thank you for explaining that to me. What I'm now going to go on to just explore with you, if it's okay, is some of the experiences that your daughter's worried about. Are you able to tell me a bit more about what you've been experiencing? Yeah,
I mean, it sounds completely crazy. I get that, but I want to kind of believe that it's a real thing and not an imagined thing. It's I don't know, it's things like I do still sometimes see him, and I know that sounds really strange, but just out the corner of my eye, or sometimes I can feel him sat on the end of the bed, or things like that.
And from what you're saying, is there something about having him as a sense of presence at those times?
Yeah, I don't really want to lose that.
Absolutely.
But at the same time, it does make you wonder whether you are going crazy, because obviously I do know that he died, but I don't know, it feels so real.
Absolutely. And from what you've just said, it sounds like these experiences are when you see him, or it feels like he's sitting on the bed, it's they're generally quite brief. How long do you?
Very brief. Well, sometimes when I wake up, I could just feel his weight on the bed, and I sort of think I see him sat there, and I rub my eyes, and then it's gone. And other times, if I walk from, I don't know, down the corridor between the living room and the kitchen, I sometimes see him sat in the chair, but again, I look back and he's not there.
Okay.
It's very strange. I mean...
Okay. So just to recap on what you said, you can see him there very briefly.
Yeah.
You get a sense of him being there.
Yes.
Do you hear his voice?
No.
Do you get any particular smells, or?
Sometimes I think I smell his aftershave still.
Okay, so it's mainly what you see, so visual and through smell.
Yeah, but I'm not all the time. I mean, it really could just be a few times here and there.
Okay. So from what you've told me so far, it does sound as though what you're going through is a normal grief reaction, and there are various stages to grief. So often people might be in a bit of denial. You mentioned sort of feeling in quite a bit of shock and wondering, has this really happened? Sometimes people can feel a bit of anger, towards...
I have been quite angry with the hospital and things, because I was worried that they hadn't done enough for him, and I've never really got a full explanation,
Okay. And we've touched on the low mood, which it sounds like it comes and goes for you, rather than being what we would call a depressive episode. This is more the low mood that people get within a normal grief reaction. And we've touched upon the fact that you feel safe within yourself, that you can still feel some enjoyment, some hope for the future, that you're not suicidal.
No.
It's still early days, obviously. It's still, you've only lost your husband 3 months ago. Sometimes people do find bereavement counselling a bit further down the line helpful,
right.
where, for example, it has been quite a shock, or it's been quite unexpected. That can make the grief feel a bit more impactful and a bit more severe. So that might be an option that might be worth considering in a few months' time, if you're still feeling as difficult as you are at the moment. But from what you've told me so far, this does sound like a normal grief reaction. But there is support for you whenever you need it. And thank you for talking to me.
Thank you very much. Thank you.
This was a station that was about seeing a lady who'd lost her husband of 30 years, and it was taking a history around grief. Clearly, an important part of the station is being empathetic about this significant loss in her life. What I was trying to do was to make sure that we explored the different areas of her grief reaction, but I was also going on to screen for any signs or symptoms of depression, and in particular thinking about any hopelessness or suicidality, so thinking about risk. I also think it's important that there is proper exploration of any unusual experiences, so any visual or olfactory hallucinations that she might be experiencing, and trying to really go into some detail about were these brief? Did she understand that these were part of a reaction, or did she believe that these experiences were real? In other words, were these experiences psychotic or part of a grief reaction? And then it was really trying to go on to explain the nature of the formulation, which was around a normal grief reaction and how this might be different from an abnormal grief reaction, and the kind of support that might be helpful. So bereavement counselling, for instance, in due course if it was needed. Often what candidates do forget is to actually explain properly and to leave enough time to explain properly what is going on. So it isn't just about getting the history and any symptoms, it is also that explanation back that this is a normal grief reaction. So I hope that that explanation helps when you are assessing as a candidate someone with a grief reaction, to try and tease out, are there any other mental illnesses such as depression, which is obviously the most common, thinking about risk, thinking about whether the unusual experiences could be part of a psychotic illness or part of a normal grief reaction, and also making sure that you explain back to the patient enough detail about what's going on and just check that they're happy with that explanation. I hope that's helpful.